This slide presentation is going to be on patient-provider partnership in primary care. And as you move into the primary care courses, specifically your Primary Care 1 course, I think it's important that you understand how to develop that relationship and that partnership with your patient. You're going to have to do some assignments where you're going to be communicating with your patient. You're either going to be giving them their plan of care, their diagnosis and their plan of care, so you're going to need to be involving them in the decision-making process, and you're also going to be doing a difficult conversation simulation where you break bad news to the patient. And this is also going to be an area where you're going to need to think about the patient's preferences and their values, and involving family and trying to transition them to a different level of care. And so I think it's real important to move through this slide presentation and think about how you might be able to incorporate some of this information into your assignments for Primary Care 1. And you're going to take communication all the way through all of your primary care courses and into your clinical settings with your preceptors. When we look at patient-centered care, the definition according to the Institute of Medicine is that it is providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that the patient's values guide all the clinical decisions. And so this is one definition. When we look at the QSIN, which is Quality and Safety Education for Nurses, their definition is that we recognize the patient or the designee as the source of control and full partner in providing compassionate and coordinated care based on the respect, their preferences, their values, and their needs. So they're really very comparable to each other in how they define patient-centered care. We're going to look at Picker's 8 principles of patient-centered care, and this was developed back all the way into 1993 in a groundbreaking book called Through the Patient's Eyes. And they used a different range of groups. They used focus groups, patients that were discharged, family members, physicians, non-physician, hospital staff. And they went and looked at some dimensions of patient care, and they ended up coming up with the 8 principles of patient-centered care. The first one that we look at is the respect for patient preference. And when we're looking at this, we're thinking about the values, their preferences, the patient's rights, the dignity, the respect, their cultural values, and even the autonomy they have. And then we go into looking at coordination and integration of care. So we try to, when you give patients a diagnosis of some type of illness, they feel very powerless and they feel vulnerable, and we try to coordinate their care so we can eliminate some of those feelings. And we can coordinate that by, coordinating the clinical care as well as any type of ancillary or support services. We may need to get social workers involved. We may need to be able to coordinate transportation and to doctor's visits. And then the front line of care, we're coordinating also. For the information and education, patients, they expressed their worries that they were not really being informed about their prognosis and their condition completely. So we want to make sure that we give them all of the information that they need to make, a good decision about their health care. This also helps to alleviate some of their fears. But giving them that autonomy, that self-care, that health promotion, and providing them with the information about their condition is very important. The physical comfort, there's 3 areas that we look at with the physical comfort. It's, the pain management to keep them comfortable, making sure their ADLs are taken care of, and that their surroundings and their environment are conducive to healing. Looking at emotional support and even alleviating those fears and anxieties we talked about, because those things can be just as debilitating as the physical illness itself. So you need to pay attention, and even the caregivers need to pay attention to their physical status, their treatment, their prognosis, as well as the impact it's having on them, on the family, and financial impact, because a lot of these patients lose income when they're ill because they aren't able to go to work. And so they really have problems paying their mortgage, their car payments, all of their bills. And then involving the family and friends. It's really important that we make sure that we are involving close friends in decision making as well as family. You know, sometimes patients don't want to really talk to family members about personal things because they don't want to hurt them, but they may take a close friend and share their feelings and their emotions with a close friend and try to get opinions of their close friends. Even though they want the best for the family and they want the family to be involved, they may not be able to relay some of their concerns because they don't want to upset family members. So involving those friends in decision making, making sure that they're, you know, have appropriate accommodations for them, and to recognize the needs of the family themselves and the friends themselves, because they also have emotional needs. And then a lot of patients express continuity, you know, concerns about continuity and how their care is going to be managed. And they have the concerns after being discharged from the hospital, what's going to happen to them. So we need to make sure that their needs are met in regards to their physical and limitations, as well as their medications and their dietary needs, making sure that treatment and social services and ongoing discharge plans are taken care of, as well as the clinical and physical and psychosocial support and financial support, as we talked about. You know, a lot of times they don't have available transportation. It's hard to schedule those appointments. We need to make sure that they have access to care. Can they get to the specialist? Can they get to the appointments that they need? Can they get their medications and so forth? So those type of things are real important. So these 8 principles of patient-centered care really help to guide you in the communication process and being with you know, in the moment with the patient. So talk a little bit about shared decision making. We discussed it just briefly in a previous slide, but you know, some decisions cannot be altered. You know, when we think about decisions, about shared decision making, the process by which the optimal decision can be reached for a patient who has maybe a very bad, fateful health decision involves the clinician, it involves the patient and other members of the healthcare team, and even the family. So some decisions that really can't be altered would be if someone needs an emergency surgery, they have an appendix rupture and they need to have an appendectomy. If they've fallen and have fractured their hip and they need a hip replaced. Or maybe they have MRSA and we know how important it is to treat MRSA. These are some decisions that really cannot be altered. But most medical decisions may have more than one option. You either do something or you don't do anything. And you treat or you don't treat. And the patient may be involved in that decision saying, I'm not going for any treatment. This you could see in the real elder population, where maybe someone's in their 80s and they're diagnosed with cancer. And they say, I'm not doing anything. I choose not to do anything. I'd like to just live my life out as it is now and not do anything. And that's something that we have to honor if that's what their choice is. So the patient's involvement really has a substantial value in the decision-making process. And they really are the ones that can say yes or no, this is what I'm going to do, this is what I'm not going to do. It's very unlikely that anybody would deny having surgery for an appendectomy or having their hip repaired or having MRSA treatment. Those are things that we would never want to see altered, but the patient could definitely say, I'm not going to do anything. When we're thinking about shared decision making, it involves the healthcare provider and the patient. So we provide them options that can be discussed. We tell them about the risks, what the benefits are, and let them express what their values and preferences and opinions are. We may give them options that they don't like. They may ask about other options that we could discuss that say, you know, this may not be the best option for you, but it definitely would be an option. So we need to allow them to express their concerns and their opinions and then give them other options if we do need to do that. And family members are also very involved. You know, they can provide support and can provide input, and even other healthcare team members. So social workers, you may need to get a psychiatrist involved. You may need to get specialists involved. You may need to get oncology nurses involved. There's a whole gamut of people that you may need to get involved in getting some good patient care outcomes. But everyone should share in that decision-making responsibility to improve those patient outcomes. So working as a team is extremely important, and cooperating with each other to make the best decision for that patient. So when we're thinking about communication with our patients, there's a two-way communication between your patient and you as a provider. And this is really essential to patient care. The communication that you have with your patient builds a very therapeutic and trusting relationship. It also is very important in the delivery of high-quality health care, and it allows for shared decision making. So you as the provider and the patient are making decisions jointly about their care. There are three main goals of patient-provider communication, with the first being facilitating the exchange of the information, and then creating a good interpersonal relationship with your patient and including them in the decision-making process regarding their care. When you have good provider-patient communications, there's a lot of really positive things that come out of that. It can help with your patient's emotions because you can kind of pick up on how they're feeling. You can help to ease them through some of the emotions that they may have when you have to provide bad news to them. It also allows them to have a better comprehension of the medical information. So if you really provide your patient with a thorough history of what's going on with them, provide them with accurate information, they really have a better understanding of what is going on with them. But if you're very superficial in the information you give them, they are not able to comprehend what you're telling them. And so what they do is they go home and they start looking on the internet and trying to find out more information versus getting the accurate information from you as the provider. It also allows for you as the provider to really understand their needs and their perceptions. What exactly do they need from you? What are they going to need as they go through the process of dealing with the medical information you have just given them? And what are the perceptions that you're getting from them? What are you perceiving they need? What are their concerns? What are their fears? Those type of things. And then it can help you to also better understand what their expectations are. What am I expecting to get out of this information that you're giving me? You know, am I going to die? Am I going to get better? Am I going to have to go see specialists? And am I going to go through chemotherapy? You know, what are their understanding of what you're telling them? And that's a real important thing to try to get out of the patient, is what their expectations are. When patients report that they have good communication with their healthcare provider, they usually are more satisfied with their care. They've received the information, they understand the information, they have been given details regarding what is going on with them, and they are more satisfied with the care that they're receiving. So therefore, they have a better sense of control about taking care of their own health. They have a tendency to follow your advice because they understand what the needs are. If you don't communicate what's going on with them, they may not understand the sense of urgency, and so they may not follow through with what you tell them to do. But if you do give them good information, they're more likely to adhere to the treatment plan you have advised for them, and this can lead to having better outcomes. And they also will come back for their follow-up visits. I have found in practice that if patients understand how important it is for their blood pressure to be monitored, how it can affect their kidneys, why it's important to prevent MIs and strokes and so forth, that they have a tendency to come back for their follow-up visits because they understand the importance and they've been educated and we've had discussions about the need for it. They also recover quicker. And the studies have shown that they do recover quicker, and they're less likely to initiate a malpractice lawsuit or file a complaint against you. I can tell you that there are many studies that have been done on this, that if you've made a mistake with your patient, the best thing you can do is own up to it and tell them that you made a mistake, and that seems to prevent lawsuits. If you lie to them and they know you've lied to them, then there's going to be more of an issue. I remember one time a physician was missed a lung tumor on a patient on chest x-ray, and it was a very good friend of his. And he actually went in the room and said, I made a mistake. I read the x-ray wrong. I made a mistake. I'm very sorry. Let's move on with your treatment. If you want to go to another physician, I fully understand. And the patient said, no, I trust you. I respect the fact that you did admit that you made a mistake, and that I would like to stay with you as my healthcare provider. And so most complaints are related to communication. It's so important to communicate with your patient so they know that you've done something wrong and that you're willing to fix it. So what are some of the barriers with communication? Well, we as providers might not have really good communication skills. I think I see this more in physicians than I do in nurse practitioner providers, because we have a tendency as nurses to really educate our patients more and have more communication skills, where that's not true in many of the other professions. We also sometimes want to avoid discussions that we have to have with our patients, because we either have a limited amount of time to do it, so we rush through it and try to just get it off our plate and go on to our next patient, or our own emotions prevent us to do this. Our own emotions really get in the way. How am I going to tell this patient they have cancer? How am I going to break this bad news to them? And so you have to deal with your own emotions in order to be able to deal with theirs. The patient may also have some unrealistic expectations about their care. The provider might feel that they're going to be sued if they provide that communication, just like I had talked to you about on the last slide. And patients may feel disempowered, like they've lost control. So we need to allow them to be in control. And this is where the shared decision making comes in. They, sometimes they're discouraged from asserting their need for more information. They're afraid to ask you more information because you're going to think maybe that they're stupid or they don't need to know it. And then the patient may have some resistance. They don't want to listen to the recommendations that you've made. So those are some barriers that you deal with. What are some of the ways that we can improve our communication skills with patients to develop that patient-provider relationship a little bit better? And one of the ways that I think we can do it, probably one of the top things, is to take time with them to explain. I think we've all been in a situation where we've had things not explained to us in the proper way, and we walk out of the room not really knowing what's going on. I think that if you sit down with the patient, you really take time to explain to them what your findings were on the test, the diagnostic test, the lab test, anything like that, biopsies, and you then tell them, maybe you can't handle it, you need to refer out to someone, or maybe you can start the treatment process with medications and follow-up visits. But I think it's important that you explain everything to them that you're planning and what your findings were. Another way we can improve is to make sure that we do allow for shared decision making with these patients. Shared decision making is really a very key component of patient-centered healthcare. And it's a process in which we as clinicians and the patients work together to make decisions, and we select treatments and treatment plans, and that's all based really on the clinical evidence that balances the risks and the expected outcomes of the patient, and looking at their preferences and their values and their beliefs. So when we are engaging them in shared decision making, we're expecting them to learn about their health, understanding their condition, which is where we come into the first bullet point up here. Recognize that they do need to make a decision, and that there's pros and cons, as well as tools that we can give them and information, and cooperating with their healthcare team, as well as following through with all their decisions. So those are some really important things with shared decision making. And when we do shared decision making, it really helps the patients be more knowledgeable and better prepared for discussion. The other thing is conflict management, and we all have had conflict issues before. And with conflict management, it's important to recognize that the patient or the family's feelings are very important, and try to de-escalate any type of negativity and change that negative into a positive, because we know that there's better outcomes when we have a positive attitude. Our patients, when they have a negative attitude about something, this isn't going to work for me, I'm not going to get any better, I'm not going to feel better, my tests are never going to improve, then it's most likely that they're not going to work hard to get them to improve. But if they do have a positive attitude, I'm going to beat this, I'm going to do exercise, I'm going to work out at the gym, I'm going to eat better, we see better outcomes because the patients have a positive attitude. Being very aware of their values and beliefs is really a very important thing, because we have to understand what the patient's values and beliefs are in order to set up a good relationship with them, and also to make sure that we set up a good plan of care for them. And then understanding the social context and the respect, and to respect their right to make their own decisions. Sometimes our decisions are not the same decisions that the patient wants to make. There may be times when your patient refuses treatment, and that's because that's their choice, and we have to honor that choice. We may not understand it, we may not agree with it, but we do need to respect it. So there's a lot of times when we're going to have to put our own feelings aside in order to make the patients comfortable and respect their rights. In closing, I wanted to share this quote with you because I think it really sums up everything we just talked about in the slides. If we can view the healthcare experience through the patient's eyes, we will become more responsive to patients' needs and thereby better clinicians. Recognition of shared decision making as the pinnacle of patient-centered care is overdue. And I think this really hits home to when we discuss a lot of these things in our course, and we're working on management of the patient, how we're going to refer them, what the families are going to do for involvement, do they want their families involved, do we need to refer them out, and so forth. So I'm hoping that this slide presentation gives you just a little touch of insight into the communication process with your patient as you go through the management courses and into your clinical sites with your preceptors.